I'm Michael Smerconish in Philadelphia. The CDC changed its recommendation suggesting face coverings and announced the following. CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. Example, grocery stores, pharmacies, especially in areas of significant community-based transmission. The president was quick to note that this is voluntary, and he will not be among those doing so. I just don't see it for myself, he said when questioned. I had earlier predicted on radio that we would never see him with any kind of a face covering. My hunch was that he would view it more as a sign of weakness than prevention. Regardless, common sense dictates that where the virus does not respect boundaries, be they countries, states, communities, we need uniformity. Piecemeal, patchwork, ad hoc approaches, they don't cut it. For face coverings or for lockdowns, today's safe space will be tomorrow's epicenter. In a CNN town hall, Dr. Anthony Fauci this week told Anderson Cooper that everyone in America should be under a stay-at-home order. How to facilitate that involves issues of federalism, with which Dr. Fauci acknowledged before saying, I just don't understand why we're not doing that. We really should be. The night before, also on CNN, House Speaker Nancy Pelosi had voiced a similar sentiment saying, I don't know why the scientific community isn't more outspoken. The president probably lacks the legal authority to mandate a national stay-at-home policy. That's a subject we're about to discuss. But that doesn't mean that he's powerless. He can set an example and provide direction. As of this morning, 42 states, Washington, D.C., and Puerto Rico had issued stay-at-home orders. The resulting patchwork has had consequences. A graphic on the front page of yesterday's print edition of the New York Times tells the story. As the corresponding article noted, stay-at-home orders have nearly halted travel for most Americans, but people in Florida, the Southeast, and other places that waited to enact such orders have continued to travel widely, potentially exposing more people as the coronavirus outbreak accelerates, according to an analysis of cell phone location data by the Times. What you see in red on this map of the country is where people didn't stay home, even as the virus was spreading. What the report makes clear is that where Americans have been given clear instruction to stay home, they've largely done so. Folks in the West, the Northeast, the Midwest have been compliant. That likely curbed the spread of the virus. But those efforts will be futile if not expanded. In areas where public officials resisted or delayed stay-at-home orders, people didn't change their routine. And that ultimately poses a danger to all of us. The status quo is also simply unfair. The good faith efforts of roughly 4/5 of the country will be wasted unless everybody gets on board. The governors in states without stay-at-home orders are jeopardizing the rest of us. We need national standards, even if not legally binding, and we need clarity from the commander-in-chief. People in public need to wear masks, and everyone needs to hold in place until this passes. And the issue, it transcends politics. In fact, where the possibility of a telephone call between the president and his presumed November opponent, former Vice President Joe Biden, where that was reported this week, I think we'd all benefit from a joint unity message from both of them on this matter of national importance. And later, then we can argue, point fingers, and vote. But now we need to get on the same page and rid ourselves of a deadly virus. My first guest has been advocating that everybody wear masks in public, store-bought or homemade. He explained his logic as follows. At the height of the HIV crisis, authorities did not tell people to put away condoms. As fatalities from car crashes mounted, nobody recommended avoiding seatbelts. Yet in a global respiratory pandemic, people who should know better are discouraging Americans from using respiratory protection. Jeremy Howard